Hi, my name is Stephanie. I'm a nurse practitioner here at Healthcare Clinic, and I would like to talk about children and elimination, specifically bowel health. As you know, if you've had an infant or newborn, I should say, they often have bowel movements every diaper change. Okay, that's considered normal, particularly if it's a breastfed infant where they have yellow seedy stools with every diaper change. And a formula-fed infants then have a little different colored stool and consistency, can be tan and kind of pasty. And then as our children have bowel movements in their diapers, that can be harder, and it can be varying consistencies based on what they're eating for solids. One of the things that I like to do for older children when they come to see me in clinic for their well visits is to, of course, ask about their poop. Now, they think it's hilarious because, what's better than talking about poop, farts, things like that. But at any rate, it does matter. And so what I tend to use is a Bristol stool chart. So I do have them take a look and tell me what it looks like. Does your poop look like little rabbit pellets, number one? Or the second kind is like a sausage, shaped but lumpy. The third is more like a snake, smooth and soft. Or is it number four, with fluffy pieces, okay? Or five, watery or loose. Now, what's considered normal in this chart? Well, for children and adults, actually, we should strive for a 3 or a 4 type stool. And that tells us that we're processing the nutrients well, we're eliminating normally. Now, you may think that's kind of hilarious too, but it is a helpful thing for kids to see and for parents to see as well. And certainly if it's a number 1 or number 2 stool that's more hard or pellet-like, then we know that child is more on the constipated side of things and likely needs more water to drink during the day, but also may need more fiber as well. And I'll talk a little bit more about that in a bit. Now, certainly if it's watery or loose, there's something up. It could be that your child is sick, with gastroenteritis, some diarrhea, particularly if it's clear and explosive, that would tell you there's a virus involved. Here's how your child can have regular bowel movements. They need to drink lots of water. Okay, well, how much is enough? Well, generally speaking, about, say, 4 cups of water per day for the average kiddo who's a younger child. Certainly more as they get older. I use kind of the rule of having light yellow urine about 5 times during the day, starting by noon. Now that tells us that child is probably getting enough water. And for things they can eat to help them with digestion and bowel health, really recommend a variety of fruits and vegetables and whole grains for that purpose. Some of the things that have fiber in them are peas, peaches, pears. I call them the 3 Ps. The 3 Ps that can help you go poop. So those are the things that if children like that, those kinds of foods, those are really helpful at adding fiber. I don't really recommend juices unless it's a pear juice or even diluted pear juice that can help the younger ones have a regular bowel movement. Certainly if your child has mucus, like white mucus in their stool, that can indicate infection, or certainly if there's blood in the stool. If it's on the outside of the stool, it could be that they're constipated and they might have scraped the inside of their bowel on their way out, and that causes kind of a red blood. But But certainly, if you notice red blood on the toilet paper, or in the stool, make sure that your child is looked at. Okay, and if your child is having frequent loose bowel movements, please call your healthcare provider to talk about that as well.